And my name is Dwayne Winter. I'm part of the Brotherhood initiative, as well as Mary Rowe. And our speaker tonight is Dr. Ron Mill. So before we start with Dr. Mill, I'll give you a little background about Dr. Ron Mill. So Dr. Ron Mill is the grandson of a Dr. Alfred Waddell, a Trinidad-born Black doctor, a graduate from Dalhousie Med School. He was actually the first physician to attend to the medical needs of the people of Africville back in the 1930s to 1940s. In those days and before the advent of government-supported universal health support, the Blacks generally only saw doctors on the medical emergency situations at hospitals, and they obviously had no coverage or medical insurance. So unfortunately, a lot of preventable health situations were not seen by the Blacks. Anyway, Dr. Waddell, Dr. Mill's grandfather, first lived and had an office on Bronx Street in Halifax in the North End. He was steadfast in his commitment to serve in the Black community, even when there was no remuneration for his services. He was also the physician who had treated Viola Desmond injuries on her return to Halifax after being brutalized at the Roseland Theatre in New Glasgow in November 1946. She had neck and back injuries. Another tidbit of information, Dr. Ron Milne is also a cousin to the USA Olympic Judo bronze medalist and former UFC WWE superstar Ronda Rousey. So don't mess around with Dr. Milne. He'll put you in a chokehold and be all over for you. So without further ado, I'd like to introduce you to Dr. Ron Mill. There you go, Dr. Ron. Thank you.
Thanks, Dwayne. Welcome, everybody. No, you don't have to worry about me. I didn't inherit those genes. I don't know where she got that from. I don't know her actually, but her mother was also the U.S. women's judo champion. I don't think she was in the Olympics, and she's now a PhD in mathematics, a pretty smart lady, Dr. Anne-Marie DeMars. Anyway, so this is our second community Zoom meeting. Our first topic last week was very successful. Dr. Dakota Clayton, who's an audiologist, talked about hearing problems, and we had a lot of participation, a lot of questions, and so I hope this one will stimulate a bit of conversation as well. Coming up next week, we're going to have Dr. Jacob Cookie, who's a psychiatrist. Some of you know him. That's going to be a very good talk. I would say I'm an amateur psychiatrist, but he's a real one, so that's one you shouldn't miss. And also in future, Dr. Ingrid Waldron has agreed to do a talk for us. She's a PhD from Dal School of Nursing, who does research into Black mental health, especially Black women's mental health. And also other topics where we have a dentist who we're hoping to come and speak one night, and a dental hygienist as well. So stay tuned. Lots of good stuff coming up. So tonight, I'm going to divide this into two parts. The first part, you know, we're living in an age of anxiety right now, no doubt about it. The anxiety around COVID and isolation, quarantine, you know, how do we cope with this? So I thought it's a good time to talk about anxiety in general and anxiety disorders, which is probably the commonest mental health problem that we encounter in medicine. And then the second part, I'm going to talk a little bit about COVID, just a little bit of an update and a few things that I think pertain to Black people that are important to talk about. So without any further ado, I'm going to start Mario's going to do the slides for me, because not only did I not inherit the fighting gene, I didn't inherit the technology gene either. So Mario's he's gonna be my point man there. So Mario, if you want to do the first slide here. So anxiety, it's a general term. Basically excessive worrying, nervousness, but it goes a lot deeper than that, and has a lot more components to it. The cause really is not known. It seems to be that it originates in the amygdala, which is a part of what we call the limbic system. The amygdala is a portion of the brain that's in the temporal lobe up here, and it stores memories and also perceives emotions. So it's the emotional part of the brain and one of the memory parts of the brain. And those two things sometimes can combine to lead to anxiety, because memories that you've stored there in the past generate emotions, and then that generates behaviors and so forth. And one of the theories is that the amygdala is overactive in some people who have anxiety disorders. What the reason for that is, we don't know. It may be partly genetic, meaning that some people are vulnerable to developing anxiety disorders, and depending on their environment, their circumstances, their upbringing, that may develop into an anxiety problem. Then other causes, experiences, which especially about trauma, which of course with our Black population, we know there's a lot of trauma, a lot of it's intergenerational, going far back, and that can be a trigger again to making people vulnerable to things like anxiety, and especially PTSD, which we're going to talk about a little bit later. Then for some people, it seems to be an environmental problem, in that the beliefs and the upbringing that they have makes them nervous, worrying, anxious, afraid to test the waters, and even afraid in social situations, which is one of the anxiety problems that we see, a very, very common problem in young people, which I'm going to talk about. So next slide, Mario. So some of the predictive features, we know females seem to be more prone to anxiety disorders. Whether this is really a biological fact, or whether it's because women tend to seek help more and men perceive it as a weakness to go to the doctor, admit a vulnerability, admit that they're anxious or nervous or worried or can't cope with things, parts of their life. And that may be a factor in why women seem to report anxiety more often. Poverty, of course, is one of the things, and all the social determinants of health that contribute. Then another thing that we call ACE, which is adverse childhood events. And more is coming out about this, that it really creates a vulnerability in some people. Some people seem to be extremely resilient. They can cope with a lot of horrible things that they witness or that happen, and they're able to go through life and live more or less a normal life. But for some people, this is a real devastating, tragic problem that really interferes with their life and ends up resulting in PTSD, substance abuse, all kinds of issues in their lives. Then chronic physical illness, especially cardiac problems, respiratory problems, things like asthma, COPD, of course. If you know anybody who's got bad COPD, they're essentially all suffer from some anxiety or the other, just because of the feeling that your air is being shut off and you can't breathe. That's definitely going to create anxiety. And then tying this into the ACE, the adverse childhood events, is mental problems or substance abuse in parents. A very common problem that we see, which really does have devastating effects on children, especially going into later life, and not only effects in their mental health and their behavior, but actually physical problems. We know that people who suffer because of serious problems in their upbringing years and problems with their parents do have an increased risk of developing certain illnesses, physical illnesses, as they get older. Okay, Mario, next slide. So anxiety, basically it's a very ancient characteristic that humans evolved called the fight or flight response. So way back when our ancestors were in Africa, anxiety and fear was a very useful emotion, because if you had a saber-toothed tiger hunting you, or you know, some kind of threat like that, then being on alert, being in a high adrenaline state was probably a useful thing. And then these so-called fight or flight hormones like cortisol and adrenaline. But some people with anxiety states have this all the time. They're on high alert all the time. So they're in a high adrenaline state, a high cortisol state. And we know that such a biological condition leads to a lot of physical as well as mental health and emotional problems. So 1 in 10 people are affected by anxiety. As I mentioned, women more frequently than men statistically. And this can lead to family, work, social life issues, and unfortunately to substance abuse and depression, which we see so often with alcohol use, hard drugs. I won't include cannabis in that, though. I mean, there is a cannabis disorder in which some people do use it excessively, and it can lead to problems. Okay, next slide. So what are the symptoms of anxiety? We've all experienced feeling some of these at one time or another, but I think the first 2 words are what really sums up what I'm talking about: excessive and uncontrollable. So people that are constantly on edge, worrying, restless, irritable. You can see this leads to fatigue, muscle tension. We see a lot of people with anxiety who come in not with a diagnosis of anxiety, but they come in because they have physical symptoms: headaches, neck and shoulder pain, back pain, very, very common. And a lot of times these people have on the route, they've gone to chiropractors, they've done massage, they've gone to naturopaths, they've done, and sometimes naturopaths help them for sure. But you know, they're looking at the physical symptoms and convinced that they have a physical problem. And I didn't include, for instance, GI problems like irritable bowel syndrome, which is so very commonly linked to anxiety problems. So these are some how this is really a setup for people to do self-medication and unfortunately go on to drug use. Because if you have pain, if you don't sleep, if you're irritable and nervous and anxious, a lot of people deal with that by either drinking alcohol, smoking weed, using other drugs, using painkillers. Unfortunately, sometimes some of the people with chronic pain get put on painkillers, opioids, some things that really cause a whole other set of problems. over and above their anxiety disorder. Okay, Mario, next slide. So there are different anxiety disorders that we classify. Out of those, generalized anxiety disorder, which is basically what it says, that the person is nervous, anxious all the time, and it affects pretty much all aspects of their life and their functioning, especially their relationships at home. Specific phobias, they're not as common, but I mean, some people do have, they're terrified of snakes, or they have other specific fears or phobias. Along with that, obsessive compulsive disorder, OCD, where people do repeated activities like washing their hands continually, cleaning, many other things that they do because they're fearing disease or other things that leads to anxiety. And the activities that they do, like hand washing, are to sort of avoid those things that they fear. Panic disorder, that's a very devastating one. I don't know, some people probably have experienced panic attacks. It's pretty common. And sometime in many people's lives, they do have a feeling where your heart will start to pound. Maybe you get a bit lightheaded, your breathing speeds up, you feel a tightness in your chest, and it can be like someone's having a heart attack. And they're very real to the person experiencing them, and they really do feel or fear that it's, they're having a heart attack or they're having some physical complaint. So as a physician, you really have to dig deep sometimes and to get at what's causing this. Is it actually a physical problem? Do they really have a breathing problem or a lung problem or a heart problem? And it takes some sorting out for sure. I think the one thing people don't like to hear is, being dismissed and told that it's all in their head, because we know these things have a physical basis, even though maybe they are caused by a psychological issue or a trauma or whatever. The physical symptoms and the pain people experience, they're very real, and they have to be addressed in one way or another. So some of the other anxiety disorders, agoraphobia, which is sort of a fear of being in crowds and being out in wide open spaces. And for some people, this can be very devastating to their functioning because they don't want to go out at all. PTSD, which is a disorder that's characterized by intrusive thoughts, feelings, memories, nightmares, sleep problems, sometimes panic attacks. And this usually relates to past incidents that have happened to people, traumatic incidents, both things that they've experienced or things that they've witnessed. And for some children who witness violence or are affected by violence, PTSD becomes a real devastating problem. And unfortunately, I think some of our first responders now, with all the the death and the illness and sickness we're seeing, some of them are probably going to be affected by that. Then social phobia or anxiety. This is one I see very commonly in young people today. And some of it, I think, has to do with social media and kids being on there and bullying, saying, cruel things about other kids. And it can be a real problem for them. And also for people who are just afraid to go out in groups and be in social situations. And of course that can lead to substance use too, especially alcohol, where people need to have a few drinks before they can go out and and even socialize. Next slide. So there are some concurrent disorders that go along with anxiety disorders. Mood disorders is a very common one. So anxiety and depression are very closely linked. Some people feel actually they're the same thing, that just manifests in a different way. But very commonly, mood disorders accompany anxiety at some point. And the treatments can be very similar as well. Substance abuse we talked about. And the ironic thing is many of the drugs that people abuse, amphetamines, cocaine, ecstasy, even caffeine, all make anxiety worse. ADHD, very commonly young people who have ADHD, and also older ones that go undiagnosed, anxiety is frequently connected to that, and depression can be as well. Schizophrenia, that's one we don't think of always for anxiety, but for some people, their anxiety is due to the fact that they're either hearing voices or have an altered perception of reality, and this creates anxiety for them. When you see them, there's usually other clues in their mental status, and either they're delusional or having hallucinations, visual or auditory or whatever, but and sometimes paranoia too. But it can be hard sometimes to initially connect those two things. Okay, Mario, next slide. So outcomes. We know that people with chronic anxiety, many of them probably because it's a high adrenaline, high output kind of state, they have increased heart rates a lot of the time. High blood pressure is commoner with anxiety, probably again because of the cortisol and adrenaline, fight or flight hormones that are produced. And unfortunately, as a result, cardiac diseases, coronary artery disease, is commoner as an outcome with anxiety disorders. Substance abuse, self-medication, very, very, very common problem. Again, some of these symptoms of anxiety, which are not recognized either by the person, and particularly, again, I go back and say that for men, because a lot of times men don't want to admit to any vulnerability, they don't want to go and get help. A lot of times it's a family member, usually their wife or their partner, that's pushing them, come in and you've got to do something about this and get help. And but a lot of times people try to self-medicate and ignore the signs. Mood disorders, interpersonal problems, and this is not only in marriages or relationships, it's with family, it's with friends, because a lot of times people go undiagnosed. Even if they are diagnosed, their friends or their family don't really understand what it's all about. So as a result, they become stigmatized. Oh, stay away from him. He's crazy, or he's he's psycho, or whatever. And unfortunately, that leads to isolation of people, that they just give up, and they can't get along, they can't connect to people, so they go deeper and deeper and deeper into their shell, sometimes into depression, substance abuse, unfortunately sometimes even into suicide. And that's a real tragedy that happens. So it's important, trying to understand people so their treatment won't be delayed, so that they will get help, because there is help for anxiety disorders, and a lot of them can be treated very effectively. Okay, Mario, next slide. So we come to treatment. The first thing I have on this slide is CBT, which stands for Cognitive Behavioral Therapy. Some of you might be aware of this particular treatment. It's a validated treatment, which actually, if it's done correctly and the person buys into it, which is a big part of it, because you have to do the work and there's a lot of homework, assignments and whatnot that you have to do in order to understand your problem and in order to help it. So it's basically making the person aware of some of their thoughts and behaviors, changing the thought patterns, challenging some of the assumptions that they have in their anxiety that, for instance, oh, I don't have any friends, nobody likes me, I'm no good, I suck, I'm not smart, a lot of these things that then lead to the negative emotions that lead to negative behaviors. So cognitive behavioral therapy is about changing the way people view themselves, the way they view the world, and it's a very effective form of treatment. In fact, head to head, it's probably equally as effective as medications, which we'll talk about in a minute. Desensitization is another form of therapy for people with phobias, where they're taken through their fears in sort of a safe environment to become desensitized to the issue that's really interfering with their life. And that can be quite effective also. So breathing and relaxation exercises. I sort of combine these next two. Breathing and relaxation exercises, which are very good to people who are tense and anxious. Sometimes it's difficult for them to make the transition to learning to slow down, find a quiet space where they can be alone and be safe and really focus on slowing their breathing down. We know that doing meditation and doing breathing exercises for anybody is a good thing. There was a book that came out in the 1960s by a psychologist called The Relaxation Response, where this guy studied a lot of people, I think it was in New York, and found differences, biological differences, like in their heart rate, blood pressure, temperature, breathing rate, that meditation and breathing and relaxation really is very, very effective in helping the physical side as well as the emotional and psychological side. So meditation, and there's a lot of different forms of that. There's a lot of stuff online that you can learn. I think it's good to, if you have a teacher or somebody that can take you through some exercise, some meditation exercises, mindfulness as well, being able to focus on the moment so that you're out of your treadmill that you're on with the anxiety and worry and so forth. The mindfulness and meditation exercises are very good. I do it myself, probably about 3 times a week. I don't really suffer from anxiety, but well, we all have anxiety of one sort or another, but I found this has really helped me to remain calm and focused. And it's surprising because you think, well, when you're doing that, it's almost like you're in a trance and it's almost like you're falling asleep, which you're not. You develop these theta waves in the brain, which we know are, they can see them on EEG, which are very beneficial in terms of your regeneration of your brain and neurotransmitters, etc. That really does help your mental state. And of course, I put prayer in there as well, because prayer is a form of meditation to me. And it's something where you are able to get out of your negative thoughts and get into a more positive kind of space. And it's a very helpful form of relaxation and regeneration. So then we get to medications. We do use them for anxiety as well as depression. I think the commonest antidepressants used today are the SSRIs, or selective serotonin uptake inhibitors. We don't really know how these drugs work. The theory is that they replenish neurotransmitters in the brain, but it's something that can't be measured, and we don't really know. There's other theories that they're anti-inflammatories and they reduce inflammation in the brain, which might be one of the causes of anxiety and depression. Again, it's something that really can't be measured. So these things are all theories. SNRIs, which are like SSRIs, but they work on a different neurotransmitter, norepinephrine. And then another one called mirtazapine, which is very commonly used, which is also good for sleep, and it helps some people, older people especially, that lose their appetite because they're depressed, and it does help in those regards. The benzodiazepines, to me, that they're not really a first line. Drugs like Valium, lorazepam, Xanax, diazepam. These drugs, I mean, they do have some usefulness, and we do use them. I try to use them very short term and for very specific things, like if a person has fear of flying, or they're very anxious about something that's coming up, or they're going through a very rough patch, they can't get calmed down, and you know, they need something for short term. Some people, though, do remain on these drugs long term. We know there are some issues with them. They can develop a dependence on them. There is a benzodiazepine withdrawal, which is very nasty when people go through that. So if you come off them, you've been on them a long time, it has to be a very, very gradual wean, because they alter the receptors in the brain, and this leads to real difficulty in getting people off them. So there's something we don't use as first-hand or first-line treatment, but they do have some use. The other use is you've maybe seen people, or maybe even taken lorazepam that's put under the tongue. So some people who have panic attacks, which are just debilitating for them, they put one of these lorazepam that's fast-acting, dissolves under their tongue, and it can have a calming effect, you know, within 15 or 20 minutes. So that's another use. I put cannabis up there with a question mark. Lots of people self-medicate and use cannabis for pain, to help them sleep, and to calm their anxiety. And they feel it works, and for them it probably does. It hasn't been validated, and there still really hasn't been enough research done on cannabis to bring it into the mainstream, even though it is, you know, we do have medical cannabis, and it's legalized in Canada and some states, but there's still a stigma about it. There's not enough information about it. We really don't know what are the best indications that it works for. There are a few we know that are effective, but other things that people are using it for that I think are questionable. So then there are lots of non-medication treatments, and I always like to focus on these first before we even start talking about medication. So exercise. The more we find out about exercise, it's just more and more beneficial to people, especially to get outside in nature and, you know, go for a walk, ride a bike, paddle a canoe, paddle a kayak, swim, you know, just walk and hear the birds and walk through a forest or something like that. This is very, very beneficial to relaxing people, helping focus their thoughts, helping calm them down. So exercise, definitely. Weight training too is very good. Even for the elderly, I've recommended to some people, even people that have heart disease, because they've shown that improving your strength, improving your muscle tone helps people even with heart failure, which, I mean, you would think, well, it might make them worse and give them a heart attack. No, if it's controlled and they're using low weights and high reps, they actually do better. So even for the most vulnerable populations. Socialization, that's a big one, especially, of course, for people who are isolated, and that's where that stigmatizing comes in, because people that have anxiety need to be in contact with other people. And unfortunately, sometimes their friends or their family don't understand this. They don't understand the disorder, and they avoid or ignore the person, and that's very detrimental. So diet, a lot of things in diet. Reducing caffeine is a big one. Caffeine has some positive benefits, but there are some people, I tell them it's like you have an allergy to it. You know, if you don't sleep well at night, then caffeine is something you should be really minimizing, especially after about 4 o'clock in the afternoon, because that's going to stay with you and, you know, contribute to you being restless, not being able to sleep. Sugars, especially, you know, sweetened drinks and refined sugars, not good for anxiety. Alcohol, of course, and a lot of people do self-medicate with alcohol, but alcohol is actually a depressant too. So people that are depressed, they drink the alcohol, they calm down a little bit. 2 or 3 hours later, they got to have another drink because, you know, they're sinking again. Processed foods, energy drinks, again, because they're very high in caffeine. So those are some of the things that we try to avoid in people. Smoking is another one, but sometimes it's very hard to get people to change a lot of their behaviors at once. So, you know, we may try to focus on one thing at a time. So as far as what you can eat, I think increasing your vegetable intake, especially green leafy vegetables, fish and nuts, which are high in omega-3s, and these are very beneficial not only for your heart, your blood pressure, your circulation, but omega-3s also help people psychologically. So as much of those kind of things, especially fishes, you can get. Antioxidants, so these are the sort of anti-aging kind of foods, like anything type of fruits that are colorful, like blueberries, cherries. Apple is very good, spinach, beets. Turmeric is one that has a lot of anti-inflammatory effects, and also has some positive psychological benefits. And ginger is another one that you know is useful. Okay, Mario, next slide. So for family and friends, learning about the disorder is important. If the person suffers from anxiety, it's very real to them, even though sometimes we look at somebody and, you know, they're breaking down and they're crying and I can't do it, and, you know, I'm too nervous or I'm too worried and I can't function. Understanding that is real to them, and trying to you know, do your best to get them out of that and help them with it. Supporting the person to face their fears, especially with social anxiety, going with them maybe when they're going out somewhere in a social situation, and being a support for them, helping them with phobias that they have. Giving encouragement to make changes. It's very hard for all of us. to make changes, no matter what they are. You know, we tend to hold on to our behaviors that we know, and some of them, unfortunately, are not positive behaviors. And you know, people need support to get through that. Whatever it is, they're trying to quit smoking, trying to cut down on their drinking, trying to change their diet and lose weight. Everybody needs encouragement, and they need the understanding. And I think the last one is important. Understand that anxiety is not a character flaw. It's not a weakness. It's an actual illness. Like a lot of mental health problems, we don't totally understand it in the way that we understand, well, you're a diabetic, type 1 diabetic, you don't have any insulin in your body, you need insulin to bring your blood sugar down, and then, you know, you'll feel better and avoid the complications of diabetes. We don't understand depression and anxiety in those kind of terms. And so sometimes mental health illnesses are viewed, you know, in a very negative way by people. And that's important, to not stigmatize, not judge the person, not traumatize them further and make them even more isolated than they already are. So yeah, I think that's about what I had to say about that. We got some questions there. Let me see. Can you repeat what you said about FDAs? It is theta waves. Yeah, THETA, theta waves. So these are sort of relaxing brain waves that are generated through mindfulness and meditation. The other thing, positive thing about meditation is some of these people who are really heavily into it, like monks and people like that, they've studied these guys and they can lower their heart rate to unbelievably low levels, and their blood pressure too, just by being in this sort of meditative state. I mean, I think it's something probably most of us, you know, can't achieve that, but even if we can get a portion of that benefit to lower our blood pressure, for instance, that's very helpful. Also, what health issues and illnesses can result because of chronic states of stress where hormones like adrenaline and cortisol are continuously produced? So that's a good question. So I would say the commonest one we know about is hypertension, high blood pressure, and but also cardiovascular diseases. So heart disease, heart attacks, vascular problems, blood clots, all of these things, you know, can be affected by a sort of chronic fight or flight state. Probably diabetes is in that category too, at least type 2. I mean, diet is definitely part of that as well, but can it cause or contribute to different forms of cancer? Many people believe that it does, because the other thing that it does affect is the immune system, which I'm going to talk a little bit about next. And we don't know a lot of the exact effects on the immune system, but we know people that are under stress, you know, may tend to have more illnesses like, you know, colds and flus, and pick up things like that, but also some forms of arthritis and possibly inflammatory bowel diseases, things like that, can contribute to it for sure. So yeah, that's a good question. Can this list of holistic treatments be used instead of medications listed above? I'm not sure which holistic treatments, or if you mean the things I mentioned. Yes, absolutely. And my approach, as I said, almost always is to talk to the person about their lifestyle, about their living situation, about their diet, about how much they exercise, whether they, are in supportive relationship or in a supportive group, like a church group. No matter what it is, something that, they can get positive energy from. So, and of course, the diet part is really important. I mean, the things I mentioned, they're all things that I do as far as my diet, try as much as I can. And, I think those are all things that people can try. Certainly like meditation and mindfulness, if you can get yourself into a state where you can do those things, and breathing exercises, those definitely can benefit you and can lead to not having to either self-medicate or take prescription drugs, which are not the best solution for everybody. Some people need them, and it's hard for them to make the changes in their life or to do some of the other things. And the other thing that's that can work that way is if you get somebody on medication, the drugs they take, usually they have some benefit within about 2 weeks, but they take about 6 weeks to have a maximum effect. And after that, if the person's anxiety or their depression improves, then they're in more of a position that they can start doing some of these things and helping themselves, getting out and exercising again, improving their diet, working on their smoking, meditating and doing mindfulness and breathing exercises, and then hopefully progress to a point where they don't need the medication anymore. And people do get off antidepressants. There's no doubt about it. When you prescribe them, I usually tell people, most people who take these drugs, if they work, and they don't work all the time, probably 70% of the time they work. But if they work, you probably need to be on them for 6 to 12 months. But you can certainly get off them. You can wean off them. The antidepressants, again, there's a discontinuation or withdrawal syndrome with it. So we have to go slowly, but people certainly do get off them. Some people only have one episode like that of depression, especially, and they won't have it again, and they won't have to be on medication again. So it's not something that sort of condemns you, well, you've got to be on medication the rest of your life and that's it. No, if you make the changes and, can improve your situation that's bringing you down, then yeah, you can definitely live life without medications. Is there best time to exercise? I think the best time really is the morning, but it really depends on your schedule, where you can fit it in. Some people, the job allows them to like go out for walking, for instance, at lunch for half an hour or so. And, if that's when you can do it, that's good. Why is morning best? I just feel like you tend to have more energy in the morning. It gives you a chance to get your day planned and do things. And at night, you come home, especially if you eat. I find if I eat, man, I don't want to exercise an hour later. I just, I just don't feel like it. So, but it really depends on the individual and when you can work it into your schedule. Okay, so yes, we are looking at doing more events like that. Our Thursday night Zoom meetings are going to continue and have a different speaker each time. And are we looking at doing a conference? Unfortunately, the conference we had planned for November, we can't carry through in person, but we're working on trying to do a Zoom meeting and make it sort of province-wide. So stay tuned for that, and hopefully we will be having the conference. Okay, just go on to the next part, which is talking a little bit more about COVID and a few specific things affecting Black populations. So this virus is a crazy virus. I'm going to say that up front. We just have not seen this before. And the people that are saying, I know there are some of them who are saying, it's just the flu, and why are they getting bent out of shape about, just another flu? This is not another flu. It's much more contagious and can be spread much more easily. It's a novel virus, and we've never seen it before. So our immune systems have not had a chance to respond to it and build up protection against it. And for some people, unfortunately, this is disastrous. So some of the things we're seeing that we don't normally see with these viral infections, blood clots. And the blood clotting seems to be an effect that has something to do with some components in the blood. I'm not going to get into great detail with it, but there is a component in the blood, a protein called von Willebrand's factor, and there is a von Willebrand's disease, which is a type of bleeding disorder. This clotting, von Willebrand factor seems to be higher in the blood of some people of African descent. So we don't know if this is one of the things that's leading to blood clots, but the other factor is the lining of the blood vessels, which is called the endothelium. And the endothelium is what becomes damaged that can lead to things like heart attacks and strokes, because the platelets, which are the small sticky cells that are responsible for blood clotting, if the endothelium is abnormal, they stick to that, then form a blood clot, and then boom, that travels up to your brain, you've got a stroke, or it goes into your lungs. A lot of the people who are dying because of COVID have blood clots in their lungs. So they have massive lung damage, but they also have clots that are spreading to their lungs. So this is something that we just don't see with other viruses. And I don't know if it explains the higher mortality in African Americans. I think that is a complex thing that involves a lot of factors that I'll talk about some of them, but that probably is one of them for sure. Vascular problems is another one. So there's this thing called COVID toes, where we're seeing some young people with their toes, circulation shutting down, their toes turning blue or black. And again, this is likely related to blood clotting. GI symptoms, some people are getting vomiting and diarrhea before they ever get a fever, and respiratory symptoms. So again, that's kind of weird. It's attacking a different part of the body. Loss of smell and taste. We do see that sometimes in other viral infections, but it seems to be more predominant with this COVID. Nobody knows why. Kidney problems, a big one. As you know, kidney disease is a big problem in the Black population to begin with, because of hypertension, high blood pressure, and diabetes, and the long-term effects of that on the kidneys, which leads to, unfortunately, some people winding up on dialysis or having to have transplants. So this seems to be another factor with the COVID virus. So with African Americans, the mortality rate is very high. 2.2 times what it is for Latinos, 2.3 times what it is for Asians, and 2.6 times what it is for whites. And a lot of it is in the urban populations. New Orleans was one that was hit very hard, Chicago, Detroit, all of these places which have fairly high Black populations, but you're talking about 15 to 20% Black population, but 50 to 70% of the mortalities in those communities is Black people. So what's the reason for that? Some of the things are probably things that I mentioned about blood clotting. And you get into the social determinants of health, of course, which, poverty, poor housing, overcrowding, unemployment, racism, all of those things that we call the social determinants of health, which are, and of course, people not having adequate health care in the US, which is a huge problem. I think it may be one of the reasons that we've done a little bit better in Canada than in the US. I think it is a factor. But then there's the immune system. So, you know, the immune system, it's a complex thing, and I'm not going to go through a big lecture on it tonight. I don't understand a lot of it myself, but we have these B and T lymphocytes. Lymphocytes are white blood cells. And the B cells produce, you've probably been hearing the term antibodies. Antibodies are proteins that the B cells make in response to a foreign invader like the COVID virus. So now they're coming up with a test to measure antibodies to see whether people have protection. You know, they've been exposed to the virus, gotten over it, and they have protection. So we don't know how good these tests are. We also don't know about the antibodies, how long they last in your system. Do they last for 3 months, 6 months? Do they last forever? Or are you, when they get a vaccine, which is not going to be for a while, unfortunately, do they, you know, are we going to have to be vaccinated every year, like for the flu, because the virus is changing and mutating every year? We just don't have an answer to that yet. So the B lymphocytes produce antibodies. The T lymphocytes that produce what we call cell-mediated immunity. So this is the type of immune response where our cells are invaded by a foreign invader like the COVID virus, which is what they call a spike protein. So it has on the surface these spikes that attach to receptors on our cells. Then the virus gets in the cell and then starts to replicate and takes over the cell. The cell then goes crazy and produces all of these, what we call cytokines, and this thing called cytokine storm, which is what a lot of people are dying from, where it's just a crazy reaction of the immune system producing more and more inflammation in the body, which leads to damage to the lung cells. So it's not just the virus itself, it's the response that our immune system has to the virus. And that's something that I've questioned. Actually, I asked Dr. Strang when he was on, is there something in the immune system of Black people that makes this more active and more severe? And is that one reason why we're seeing more deaths? And we just don't have an answer to it. But I mean, we know that some autoimmune diseases are commoner in the Black population: diabetes, lupus, rheumatoid arthritis, Crohn's disease. You know, there's sarcoid. There's a number of them that that are due to effects of the immune system. So, is that a factor? We don't know, but you know, hopefully that's one of the things that we're going to learn. So then with the immunity, you talk about active and passive immunity. So passive immunity is where your body is given something, like one of the things they're looking at doing is giving the plasma of people who have recovered from COVID, giving that plasma because it has antibodies in it that are protective, giving it to people to protect them from getting COVID. And we don't know whether that will work, and we don't know how safe it is, but there are trials going on right now. And that's an example of what we call passive immunity. The active immunity, of course, is vaccines. So your body is given a vaccine that has either an inactivated or very attenuated dose of the virus or bacteria that we're trying to prevent. And it produces an immune response, produces antibodies, and those antibodies have memory so that the next time you're exposed to it, right away they attack the virus to prevent it from getting inside the body. And we know that for some diseases like tetanus, you know, you have to have a booster every 10 years because those antibodies only last so long. So is this going to be a situation where we're going to get a vaccine that, you know, we'll give boosters every so often, maybe every year. Don't have the answer, but that's something we're all staying tuned for. So how do you strengthen the immune system? Well, a lot of the things I talked about with the exercise, diet, especially those antioxidants and omega-3s, all those things are important. And for exercise, we talked about walking. Stair climbing is another one that, you know, if you live in an apartment building or in a condo or whatever, you have access to stairs, that's exercise. You get your heart rate and blood pressure up, and, you know, doing as many stairs as you can, that's a form of exercise if you can't get outside. Yard work, housework, weight training, they're all valid. Okay, next slide, Mario. Okay, oh, there we go. Yeah, okay, so getting 7 to 8 hours sleep per night, that's important. Cut down on your caffeine, exercise, limit your screen time, and I think this is a good one. Don't focus on bad news. I mean, if you're checking the news every hour to see how many people have died or how many have got COVID, or, you know, unfortunately, the news cycle functions on bad news and alarming people and whatnot. Some of it is good because it's, you know, it alerts people. Like, unfortunately, this incident with the shooter, might have been better if we had more alert about that. But there's enough bad news out there, you know. Try to avoid it, or try to limit the amount. The other thing is, try to get your news and your information from a reliable source, not from Facebook or not from celebrities or whatever, because there's just a whole lot of stuff going around out there right now that that's not valid. So meditate, prayer, yoga, mindfulness, all those things I already mentioned, which I think do strengthen your immune system and make you healthier. The diet we talked about. Then the last thing I'm going to mention is about the supplements. So one of the things we know, there is a channel into the cells, which we call the zinc ionophore. And when the virus enters into the cells, zinc and other zinc ionophores can get inside the cell and decrease the virus from replicating. So there's a lot of research going on right now into using zinc, like you probably have heard about chloroquine and hydroxychloroquine and that whole story, the anti-malarial drugs. We don't know how effective they are, but they are using zinc with them as well. And I think zinc probably has some promise. It's been used for a long time in a lozenge form when people have colds and whatnot. It didn't seem to be as effective for that, but I think it probably does have some benefit. Vitamin D, now this is a big one. Vitamin D increases the immune proteins and decreases respiratory infections. So it strengthens your immune system, there's no doubt about it. Folks with melanated skin don't get enough vitamin D because the vitamin D is not synthesized in their skin. And they've actually found that a number of the Black patients who died with COVID had low vitamin D levels. And so I'm encouraging everybody to think about taking vitamin D, 1,000 to 2,000 units. And I'm taking it myself because I think it does have some benefits and it may be effective against COVID. We don't know yet, but it has been shown that it reduces the incidence of respiratory infections, and it has a lot of other benefits for your health as well, your immune system and so forth, and of course your bones. So check with your doctor, make sure there's no reason that you can't take it. Like if you have an illness that has high calcium levels, vitamin D may make that worse. And of course, if you take too much vitamin D, you can get a toxicity from it. So it's got to be right for you and the right dose. Vitamin C. Vitamin C does help immune function. Very high doses of it reduce the length of viral infections, but we don't know how effective it is to reduce or prevent COVID. It might help and it might not. They're giving intravenous vitamin C, high doses to some ICU patients. So they're looking at it and studying it. Whether it's effective or not, the jury's out on that one. But I will say again, I'm taking vitamin C as well, and I started taking zinc. So those are three things. The zinc, 25 to 50 milligrams. 50 is the maximum for sure. You can't take any more than that. It can have side effects. It can lower your copper levels, which is not a good thing. So some people take a copper supplement along with zinc. You can get it from foods. There's high zinc content in meats and fish. It's in plants, but it's not very bioavailable. So you don't get much zinc from eating plants, but nuts is also another source that's high in zinc. But as I said, check with your health provider, your family doctor, your nurse practitioner to make sure there's no reason that you can't take those things. Turmeric is another one. I don't know if I mentioned that before, but that seems to have some immune benefits, and ginger is another one. Okay, next slide. So yeah, just a few things. It's normal to feel anxious about this virus. We all do. You know, I don't consider that to be an anxiety disorder. I just consider it to be realistic. Look after your own health, all the things we just talked about. Get reliable information, and I see there is a good question there about it. I think despite some of the criticisms of Dr. Strang, which I share, I think they have been putting out pretty good information about social distancing, about controlling coughing and sneezing, about washing your hands, which again, I can't emphasize that enough, about being careful in crowds. Some people are wearing masks, and you know, I don't fault anybody for wearing a mask if they go out, you know, to the, especially in the places where they're maybe not controlling the crowds as well as they should be, then it's just a little more protection for yourself. So yes, there is a lot of information out there about COVID. A lot of it's not good information, and so you have to trust the source. But I think Health Canada also, Dr. Tam, who's the Chief Health Officer, they've been providing a lot of good information there. Is it safe to use zinc if you have cardiac issues? Yes, I would probably use lower dose, maybe 25 instead of a higher dose. I'm taking 25 myself. I don't have heart problems, but can Black people trust a vaccine for COVID if presented? Good question. I would expand that and say, can anybody trust the vaccine? Because we don't know what the vaccine is going to be, how it's going to be made up, and what it's going to target. Because some vaccines target the virus itself, so they give you a very small inactivated dose of the virus. Other ones, they just target certain proteins in the virus. They're called recombinant vaccines. Those seem to be very safe. So I think if it's a vaccine like that, yes, that we can trust it. The problem is how effective is it going to be? And of course, there's always unpredicted things with vaccines. So I hope they're testing a whole lot of people with these vaccines. And there are vaccine trials going on now, because the more people you test, the better the data is that you get, and then the more recommendations you can make about who can and can't take the vaccine. Particular blood attribute that probably makes them prone to getting the disease. Yeah, that's a good question. It seems like there's one study from Wuhan, China, where this all started. There aren't any other studies to validate this one, but in their study, they found that people with type O blood seem to have a much lower incidence of the virus, of getting sick, and also had a much lower death rate. The type A seemed to have a higher incidence and a higher death rate. So it looks like type O might be effective, but there only seems to be one study out of China right now. So if you believe that, there's some of the stuff we're getting out of China we don't believe. But if that's true, I think they definitely should be doing more research on it, because you can't change your blood type, but I mean, at least it will alert people as to whether they might be at a higher risk. Vitamin D dosage, 6'3", 200 pounds. I would say between 1,000 and 2,000 units. If your diet is good, you're getting dairy products and so forth, and you're getting outside enough, then 1,000 units is probably enough. That's what I'm taking, but 1 to 2,000 is the dose for most people. In Wuhan, the Chinese medical team used IV vitamin C treating, yes, corona. Yeah, and I know it's being used in the US in some centers in ICUs. So I think they're researching it. There hasn't been any breakthroughs on it so far, as far as I know, but at least it's something that we know is safe, and you know, probably it's something that'll benefit. I'm taking it myself. Whether it's doing any good or not, I don't know. I'm taking 1,500 milligrams a day. I don't think it's harmful. You know, too much vitamin C can cause cataracts and kidney stones, but if you're taking that range of dosage, it's probably safe for most people. Good. So, any other questions now? Going once? Going twice?
Yes,
This question there?
I have a question.
Afua?
Yeah, go ahead.
Hi. Yeah, thank you for that beautiful presentation. Can you hear me?
Yes.
Okay. I had sent that article to the chat segment from this German doctor, and you were talking about something in our blood, Black people's blood. Well, I can't explain it scientifically, but his concern was that, and it has to do with sickle cell and the chloroquine that people like President Trump and others are pushing for the world to take COVID sufferers. But he's saying what they have seen in Sweden, he was in Sweden at some point, is that there's this attribute within certain specific Black population that they cannot take chloroquine. For example, if you have sickle cell or the trait, it's almost like a death sentence to give such a person chloroquine. And he said research has been done in Brazil, in Europe, and in the United States, and they do know of this. So he's wondering why the CDC and the World Health Organization is ignoring that. So the article is there, people can read it, but there are specific populations on the planet. So for example, Southern Europeans, South Asians, Mediterranean people, and African descended people, whether in Africa or elsewhere, Canada, Jamaica, United States, that many of us have the sickle cell trait, or we have sickle cell. And so this doctor is really, really concerned about the lack of protocol in with regard to certain populations. And it seems that when it comes to Black people and Black health, that we are willing to ignore some of these concerns. I know now there's this to for everybody to take chloroquine. And we know that people who have sickle cell trait or have sickle cell in Africa, for example, will never give them chloroquine because it can cause lack of oxygen and where the red blood cells just kind of, fall apart. So I just wanted to know your take on that.
Yeah, thank you for that, Afua. I think that whole chloroquine story, there's going to be a lot more come out about that, because personally, I feel like there are some people who are going to benefit financially from that. Novartis is one of the companies that makes chloroquine, which I think is, Novartis is Swiss, I think. And there are a lot of people that are invested in that company. There really was not very good evidence that chloroquine is effective, and we have a lot of evidence, and some of it's from Brazil, that the drug is quite dangerous for a lot of people. And Brazil has a very high African descent population. It has the highest population of African descended people anywhere in the world outside of Africa.
Yeah.
So, I think that's a place where maybe they were using it too freely, and a lot of people died mainly of cardiac problems there. So they started using hydroxychloroquine, which is a slightly safer version of the drug, though it still has potential side effects. But so far, I think the combination of zinc and hydroxychloroquine, there has been no big breakthroughs as to effect of against the virus, and it does have a lot of side effects. So that's true. Somebody else was going to ask there, I think.
I wanted to know about zinc and how dangerous can it be if you have a heart condition?
Yeah.
Like, I suffer from pulmonary hypertension. And how much zinc, like, is it important for me to take? You're saying something about its importance about zinc.
Okay, well, zinc, probably 25. Some people take even less than that. The pills come in 50 milligram dosage. The ones I'm taking, I break it in half and take half of one. And that should be safe for most people. What I mentioned was zinc can lower your copper levels, and that can cause problems. And definitely shouldn't take more than 50 milligrams, but I recommend most people probably 25. But I would check with your doctor first, because the doctor knows the history and the heart condition and so forth. You say it's pulmonary hypertension?
Yes.
Yeah. Okay.
I'm on home oxygen.
Okay. Yeah. As far as I know, I don't think there is any contraindication there. I don't think there's any reason you can't take it, but I would stick probably to the lower dosage. And also, as I said, you can get it from foods too, but you can get it or through the supplement. We don't know yet how effective zinc is going to be, but it's certainly a drug that they're investigating and using, and whether it helps prevent, we don't know. Okay.
So I actually have another question. I hope you don't mind.
Sure. No, go ahead.
So I've been having a lot of trouble with sleep. I suffer from insomnia, but my insomnia has been way out of control, and most days I don't sleep for 2 and 3 days straight. And then when I do sleep, it's with an aid. and I usually get about maybe 2 to 3 hours with a sleep aid. How dangerous is that? Because I mean, I'm feeling the crunch. My anxiety level is really, it's really tough. And I know it must be tough for these people that live with me, my family. I know they probably want to throw me away somewhere.
Yeah. Is it sleep apnea that you have?
Well, it's being investigated, so I'm waiting because I have home oxygen, so that does help, and I have a special bed, but right now it's being investigated. My oxygen level goes down, but it doesn't really matter. It could be when I'm even sitting up, not doing anything. So
Okay.
they're not 100% sure if it's sleep apnea.
Yeah, because untreated sleep apnea can certainly lead to pulmonary hypertension. But yeah, I mean, it's not a good thing, because sleep is one of the body's main restorative functions. So if you're dealing with a chronic health issue like that, then not getting sleep is not a good thing. But how active can you be with the oxygen? Like, are you able to do?
I do meditative type exercises like qigong and a bit of tai chi.
Very good.
Most days, and I try and keep it at a certain time, twice a day. So yeah, I do it pretty well.
Yeah,
I try and stay off of technological stuff like my phone or the computer, even when I can't sleep. So, but it's tough because then you're sitting there, or I do a lot of artwork, or I watch a lot of unnecessary TV on purpose just so that I can have that, what I call white noise.
Yeah.
And that does help, but I don't know what it is. I haven't figured out for years what the insomnia is that causes me to be able to stay awake and not feel very tired. That's what I don't understand. The thing that the only thing that's really troubling now is because of the pandemic, that's causing me fear and anxiety to be out of control. Before that, my insomnia was fine, or at least it felt like, okay, well, I could deal with it. Now I don't seem to. Memory loss is really playing a role with me, forgetting things, feeling like I have a sense of narcolepsy during the day.
Have you tried putting on music instead of, like, relaxing music instead of the white noise in the background?
Yeah. Not as much as I should, I believe.
Yeah, so that's something that may help. Also, trying not to nap as much as you can. I mean, I know with that kind of lung disease, you got to conserve your energy. There's no doubt about it. But if you can try to do the meditations instead of napping, then
yeah, napping doesn't. I don't really nap.
Yeah, no, that's
usually day 2 or day 3.
Yeah. So, how about like things like caffeine intake and
No.
Colas, Coke, Pepsi?
No.
No.
I don't drink that.
Okay. And what time do you typically go to bed?
Well, I lay down at 10. If I don't feel tired by 11 or 12, then I sit back up. And that's when I start doing my meditation and mindfulness.
Does that get you back to sleep?
It does for a bit, and it could be maybe 45-minute stretch.
Yeah.
Then I'm back up again.
Napping, yeah. Well, I think you're doing the right things there, and it's important to try and go to bed and wake up at the same time every day, like to have a routine. And as far as where you sleep, it should be quiet and dark and the right temperature, so it's not too hot or not too cold. Sometimes taking a warm bath, an hour or so before you're going to go to bed, maybe putting some Epsom salts or something, some scented stuff in there can help relax you as well and sort of give message to the brain that it's time for sleep. So that's another thing you might that you might try.
And I noticed that on your site here, it said something about watching a lot of the news is not good either. So I kind of cut that out. Maybe 20 minutes a day, and that's it. One message, so a show, and that's it.
Yeah, I think that's very, very good advice because we all got enough things to worry about in our life every day without over worrying about this virus and about getting sick and whatnot. And I think if you're doing the things you need to do, being safe and following the social distancing and so forth, then I think you really don't need to be listening to news or to advice, especially online. I just find a lot of that stuff, it just provokes more anxiety in people because some of the things that people put out there, they do it in a way that looks very authoritative and accurate and so forth, and it really isn't. You've got to consider the source of everything that you see on there, and you've got to find a source that you trust and that's going to give the right advice, because otherwise I think it just increases your anxiety.
Do you think it's a good idea to start having focus groups? Because this Zoom program is really good. I mean, we kind of rushed home to get here so that we could talk. I know I'm very chatty, so everybody, I do apologize, but I'm quite excited. It helped me to talk about, or at least my anxiety. So I don't think we, as African Nova Scotians or just as African people of descent, talk to each other enough about our anxieties, our I'm sick and tired of.
That's
together.
true. And I think sharing those things really can help, because it can lessen the burden when you realize that, yeah, she's worried about the same kind of things that I'm thinking about or that are worrying me. I see we got another question there.
Steve Benton has a question for you.
Okay.
Go ahead, Steve.
He's muted.
Yeah, I was just, thank you. Hello. Thank you again for this. This was awesome to this evening. Just really quickly, you mentioned, Dr. Milner, about racism, and I'm just curious, is the Brotherhood interested in taking the lead on, I'm thinking even during this COVID, there's an opportunity maybe for an organization to take the lead as it pertains to the Black community and health historically in Nova Scotia and pretty globally, but let's just deal with Nova Scotia here. We haven't had anyone take the lead. Is the Brotherhood interested in that?
Well, yeah, I mean, I think it's something we tried to do in our own way, and trying to get the message out. The thing is, our focus is for men. So, clinically, of the patients that we see, almost all of them are men. I have seen a few female patients, but our mandate is for men. But one of the things that we're involved in is trying to help get a sisterhood off the ground, a Black women's health project, that's like the Brotherhood. And so I think that's one of the things that hopefully we're going to see coming down the pipe in the next year. And I think things like we're trying to do here is a way of us trying to get more of a message out about health and about the issues, and give a chance like this for people to talk. So whether it's taking the lead or not, I don't know, but I think it's something that is needed and it's necessary, and not only for all of us in Halifax, Dartmouth area, but some of the work we've done is is outreach work. We've been to the Valley, we've been to Truro, we've been to Cape Breton, to talk to communities there. And, the issues are all the same, in all the
Yes.
communities. And, the talk pretty much always comes around to lack of resources, the racism in the healthcare system, and to those kind of issues, as well as the medical diseases that are affecting Black people. And so it's something like an educational role that we really try to focus. And of course, the mental health part is big because people don't share that. They don't like talking about it. But when we get in a group like this and it's a non-threatening kind of thing, that you can put the information out there, then hopefully it stimulates people to think about it and say, well, yeah, I think my son or my partner or my mother or maybe me needs help, and try to be a leader in that way to encourage people.